Living with epilepsy presents challenges that become even more complicated when medication does not provide a solution. In order to determine effective solutions, a bottom line needs to be established. Burden of disease study, the first step toward targeted solutions.
Right now, we don't have a baseline of the impact of epilepsy for the 200,000 people with epilepsy in the Netherlands. So say if there's a new intervention that comes along, we wouldn't necessarily know how much this great intervention would enhance their quality of life because we don't have the baseline of information that says this would work, that wouldn't work, this is what they actually need, that's what they don't need. This burden of disease study is basically targeted at people who have epilepsy, especially drug-resistant epilepsy, so those who are still experiencing seizure, but not only that, because we know that epilepsy isn't a disease that affects individuals. It affects families. It affects the entire surroundings of the person who's having epilepsy. So we're also asking questions of how epilepsy is impacting the lives of those who are taken care of, or the loved ones, or the friends of people who are diagnosed with epilepsy. So those are our target audience for the questionnaire. So epilepsy, especially drug-resistant epilepsy, doesn't only come with physical burdens, both on the person with epilepsy and their families. It also comes with a lot of financial consequences. First of all, it impacts a lot of people's ability to work. It makes them use the healthcare system more, and thus would create more financial consequences, not only on their households and their loved ones, but also for the health systems. And that's what we're trying to also highlight, that having more interventions would not only enhance the quality of life for people with epilepsy, but it would also save a lot of money on the long run. It's basically 4 questionnaires for both people with epilepsy and their caregivers. So every 3 months, we ask them a few questions. These questions are about their quality of life, so how they feel, how epilepsy is impacting their everyday activities. We ask them questions about how they use the health system, how many times they went to a physician, how many times they went to a neurosurgeon. And then we ask them as well about their productivity. So if because of epilepsy, they didn't go to work, do they go to work? And we do the same, and we ask them these questions every 3 months to get a picture, every 3 months to get a picture about the entire year, how it interferes in different times across the year. And we also do the same for their caregivers. But we ask them more about their quality of life, how do they feel, how is having someone around you with epilepsy is impacting you as well. Another thing is we're going to use it. So right now we're coming with the Aim at Epilepsy intervention, which is an AI tool that helps us see the areas in the brain that causes the seizure. And if we have a better idea of what causes seizure in the brain, then we can do better interventions. And to prove that this intervention is needed for people with epilepsy, you need to show the data, like before and after. What happens, their quality of life without the intervention and their quality of life after the intervention. We need that to prove that the intervention is actually enhancing the quality of life for people with drug-resistant epilepsy, but also that it saves them and the society a lot of costs. Using this data, we'll be able to highlight the need for innovative interventions. For example, people with drug-resistant epilepsy at the moment don't have a lot of options, a lot of curative options that would help them deal with the seizures. So an intervention like the Aim at Epilepsy would help enhance their seizure outcomes for people who aren't eligible for surgery. It would help them even become more eligible for surgery. And if we don't have this data that shows this is the baseline, and if we got an intervention, that's how their lives will enhance, this is the efficacy of this, the effectiveness of this tool, then we can't really tell we can't really tell that these interventions are needed, and we can't really tell how effective they are. So right now we're trying to get the voices of people with epilepsy heard by collecting data, asking them questions, also their caregivers about how epilepsy is impacting their everyday life and the everyday life of their loved ones. And we're going to use this data to again make their voices heard, to advocate for their needs, and that hopefully will eventually have their needs put as a priority in the healthcare agenda.